Okay, do a test. Testing 1, 2, 3. Can everyone hear us? Can you type into the chat box if you can hear?
Just trying to get a read to make sure everybody has got the same audio.
Now we can hear.
Perfect. All right.
Sorry about that. I'm going to mute. Okay, go ahead, Sheena.
Sure. So what is Access Health Connecticut? We were established under the Patient Protection and Affordable Care Act to offer quality and affordable coverage to the residents of Connecticut, as well as small employers. We are the only place in Connecticut where folks can come to receive financial help to pay for their coverage if they qualify. And of course, that's based on income and other circumstances. The mission of our organization at the core is to increase the number of insured residents, retain our current members, and improve the utilization of benefits, really trying to help folks understand the benefits of having healthcare coverage and promote healthy living to them, offer affordable care at lower costs, especially with that financial health element to make it affordable for folks in Connecticut, and to work at the elimination of health disparities that exist in our state. So healthcare coverage plays a big role, of course, we know, in maintaining an individual's health, and it's really important that we, as an organization, educate our customers about the benefits of having healthcare coverage and how to use it, because a lot of people may not have had healthcare coverage in the past or have maybe had thought about it in a different manner, and so it's really important for us to educate them on the benefits of using it, and it's really important that they have it so that there's a peace of mind there in the event that there is an emergency. It's that peace of mind that they're not going to have that emergency followed up with a substantial medical bill that could put them in a really tough financial situation. And so really that's the basis of healthcare coverage, and we really want to promote that to our customers throughout the state. So open enrollment for 2017 begins on November 1st of 2016, which is only a couple of short weeks away. It will be here before we know it. And there is a note with that, that outside of our open enrollment period, if an individual does qualify for Medicaid, there is open year-round enrollment for that. So we also offer during open enrollment, which begins November 1st of 2016 and ends January 31st of 2017, we do offer enrollment assistance online, over the phone, and in person. And that in person is throughout the state, and it's certified application counselors, licensed brokers, as well as our call center. As we mentioned earlier, financial help may be available depending on the circumstances of a specific household. Over 76% of our consumers who purchase private health insurance qualify for financial assistance. And that's really important because a lot of folks don't realize that they do have an option to come through Access Health Connecticut and to receive a financial help to do so. And so where they might be purchasing an expensive plan off the exchange, once you come on during open enrollment to look at your options, you may find a cheaper, more affordable plan for you and your family. And it's also important to note that there is a tax penalty associated if you do not maintain health care coverage. And it's pretty steep. It's $695 per adult and half that value for children. And so for a simple family of four, the penalty can really add up. So when you start to look at and weigh your benefits and your options, looking at what might be available to purchase for healthcare coverage makes sense. So this is a great visual. It's definitely something we like to leave in our presentation, but it takes you through all of this essential health benefits and the key features of the Affordable Care Act specific to benefits for women, young adult coverage, and others. And so it's just a great visual to keep on there, and it's a great reference point for you all as you interact with customers throughout the state. So as mentioned, there's essential health benefits, and these are benefits that are included with all of our plans, and they do make up the core of what we like to educate our consumers on. They cover, all of our plans cover outpatient care, trips to the ER, of course, care before and after a child is born, mental and substance abuse services, which is extremely important to note, prescriptions, lab tests, wellness visits once a year, and pediatric services. And so it's what you always hope a plan would cover, and you would think it did, but the Affordable Care Act, really mandated that. And so we're happy that all of our plans include these benefits, and we do everything we can to educate our consumers about it, so they're using their health care coverage to really build healthier lives for themselves and their families. For 2017, there will be plans available through both Anthem Blue Cross Blue Shield and Connecticut, and then of course, if you do qualify and are eligible, our Husky Health and Medicaid program. This is another great visual that gives you a sense of the income breaks for an individual as well as a family of 4 to see where they would qualify. And so it's also great for our consumers to see. We do include it in our materials so that they can kind of give themselves a general sense of, okay, I might qualify based on my income for financial help. So it's that first step in looking at, maybe I qualify, where am I falling into this range, and then coming to the exchange and feeling confident that the financial help is available and you can purchase and afford the health care coverage that you need. So this will take you through the application process. So we invite all of our customers who are going to be renewing or those that need coverage to shop for their plans and look at their options. Between our carriers and the different metal tiers that exist within those, there are an array of plans. So we'd love to encourage people to shop. Once you're looking at your plans, you can apply for that financial assistance component by plugging in some simple income and household information, and then our system will determine whether you're eligible to receive financial help to pay for a private health care plan, or if your income makes you eligible for a Medicaid program. From that point, you would select a plan and you would verify all of the information in the application, and then the application is then complete and sent on to the insurance company that you have selected. So once the insurer receives your application and all of the information within it has been verified, your enrollment is complete. And so these are the next steps that your customers would expect from Access Health. It would be a confirmation letter both from our organization as well as the insurance company that was selected. They would receive their first bill from the insurance company, which is really important, as well as their ID cards so that they can start to use them for prescriptions and other appointments. And then what's really important is we really do encourage, once the enrollment is complete, for folks to get online or talk to their insurance provider and get a list of the directories and the doctors that are considered in-network, both pharmacies and doctors, both specialists and primary care specialists, because that in-network component is going to be really important for them in order to keep the out-of-pocket costs down on their plans. And so it's important that all of these steps are completed. And if you don't receive your ID card, you give your insurance company cards a call. And so each of these steps is really important to establishing that healthcare coverage once the enrollment process is complete. So we also offer dental coverage through Access Health Connecticut, and those plans are standalone and can be purchased separately, and they were mandated by the Affordable Care Act. So here are some highlights of the things that we have accomplished in the first 3 open enrollment periods. The uninsured rate in Connecticut has dropped below 4%, which we're really proud of. But at the same time, that poses, the challenge, which is, a very small number of folks in Connecticut who remain uninsured, and where they are and how can we reach them. And so it's really important for us to build community partnerships so that we can deliver our message through the trusted leaders in those communities, because we've been talking about the importance of having healthcare coverage and the penalties associated with it. But if somebody hasn't been motivated to get that coverage over the last 3 years listening to us, we're hopeful that by passing this information on and sending it through trusted community leaders, that they will get the message. And open enrollment 4 will be the year that they choose to enroll in coverage and take advantage of the benefits offered through plans. As of the end of last year's open enrollment, we had 116,000 private health insurance members. Of those, 61,000 of them were new members. And so we continue to reach new residents of Connecticut who were not previously enrolled. And of those 61,000, about 68% were Medicaid, and 32% of them were purchasing private health insurance plans. And then the last bullet here, overall, there's nearly 600,000 Medicaid members in the state. So for the 2017 open enrollment, these are some key dates that we like to share and keep on our calendars, and they're really important to consumers. So November 1st is the first day of open enrollment, so that's when open enrollment begins. December 15th is a really important date. Anyone who enrolls before December 15th, their coverage would begin on the first of the year. And so if customers have planned doctor's appointments, if they have monthly prescriptions that they need to fill and they don't want to have a gap in their coverage, they would need to enroll before December 15th for their coverage to begin at the beginning of the year. That said, we realize there's challenges. It's holiday season, people are away, there's a lot going on. And so the open enrollment period does go past the 15th of December. It stays open through January 31st. But depending on when you enroll after that December 15th date, your coverage will either begin sometime in January or February, depending on, again, your enrollment date. So we have all of these different channels for assistance on enrollment. Of course, our website is a 24/7 resource for both community leaders as well as our consumers, and that's accesshealthct.com. Our call center is full-time and always open, and the number is there for you. And then we also have in-person help by way of brokers and certified application counselors that are available year-round. And when you visit our website, you can simply click the Get Help tab. There's a very simple zip code. You type in your zip code and you're going to get a list of all of those folks that can assist you in answering questions or taking you through the enrollment process year-round. And the greatest part of all of this is our assistance is free. And so we are here to help. We are a resource, and we rely on our network of resources beyond just Access Health employees. But again, there's never a charge for the help that's offered. And, just to reiterate, the penalty, it is substantial. It's $695 for individuals who do not have health care coverage, who remain uninsured, and do not take advantage of Access Health CT and the options that we have. And so, again, with a small family, even of just 4, that can really add up as, $695 per adult, plus half that value for the cost of each child. And so it's just something to consider as you talk to folks in the community. So outside of open enrollment, so right now, anytime outside of that open enrollment period, there are special enrollments that are granted for qualifying life events. And so these are the most popular qualifying life events. If you are marrying a current Access Health customer, you can be added to their policy, and that would be considered a qualifying life event. You know, in that same vein, a divorce or legal separation that leaves you without coverage would also qualify as an event where we would open a 60-day special enrollment period for which you would be able to come on and choose a plan. Another would be adopting, or fostering a child. They can definitely be added to a policy outside of open enrollment. So new residents, if you're just moving to Connecticut and it's not open enrollment but you need coverage, you can come through Access Health CT. If you lost your coverage due to job change, if something in your job changed and you no longer are receiving employer-based coverage, you can come through the exchange and look at your options. Access Health CT is an alternative to a COBRA option as well, which is something a lot of us are familiar with. And then lastly, but certainly not least, those folks who are turning 26 and can no longer be covered under their parents' plans, that also will qualify as a special enrollment period or qualifying life event that would open up that special enrollment period for them to enroll. So we have a full list of qualifying life events on our website, but these are the most popular ones that we see come through outside of open enrollment. So now we are going to move on to some recent changes that affect our customers. So this is a really important ongoing effort that Access Health CT has to reach a certain portion of Husky customers who no longer qualify for Husky due to the federal poverty level changing as part of the state law. And so last year there was a law passed where the federal poverty line changed, and what that did was it identified a group of Husky customers who now need to purchase private health care coverage. And so throughout this past summer and ongoing, we've been reaching out to these customers to ensure that because they no longer have Husky, they are aware that they need to come through Access Health Connecticut and choose a health care plan through us in order to remain covered. And so the date for which their coverage ended was July 31st. However, we then, have those 60 days following, which would qualify as a special enrollment period for these folks to come on to Access Health and look at their options and make a selection to keep them covered and to make sure they don't have a gap in their coverage. And so we have done this substantial amount of outreach into the communities to reach these folks. And it's ongoing and it continues. And while we see great numbers of them enrolling in private health care coverage, there remains some that still need to enroll. And so we are going to do everything in our power to make sure that these folks are contacted a number of ways and realize that they do have options on the private health insurance side to make sure that they stay covered and to avoid that penalty for not having coverage. So that said, some of these folks, their income situations may have changed, and they may still qualify for a Husky program. And so we work closely with the Department of Social Services to identify those folks and make sure they're taken care of. On the other side of it, private health insurance plans are available for those who need it, and they can enroll and would certainly qualify for the financial help piece of the puzzle, both through the advanced premium tax credits that are available that offset the monthly cost that you pay to have healthcare coverage, as well as cost sharing reduction, which lower the out-of-pocket expenses. And so when you come on to accesshealthct.com, these two pieces of financial help are automatically put into the options you see based on your eligibility. So based on the income and information that the customer inputs, they would see right away what they qualify for, whether it be just the tax credits on the monthly bill, or if they are also eligible for that cost-sharing reduction component, which reduces the out-of-pocket expenses like co-pays and deductibles. And so that's all seamless through our online process. These are some examples. Again, postering, we did a lot of postcards, we did live calls to these individuals. We worked really closely with the Office of the Healthcare Advocate. We offered our materials in both English and Spanish, and we did a lot of outreach to make sure that if you were one of these folks who received the news that you would no longer be qualified or eligible for the Husky program you were in, that you knew there were still options through Access Health CT to keep healthcare coverage and to keep your family healthy. So as I mentioned, this is great information around how many folks have come back and purchased healthcare coverage, and again, also establishes those that still remain on Husky and those that still need to come through and enroll. And so we've, exhausted all of these different avenues to reach these individuals, and of course, we rely on our community partners to help us in the same. So another important update that we had for our customers this summer was the exit of Healthy CT from our marketplace. This was a decision of the Connecticut Insurance Department that as of July 1st, Healthy CT was no longer able to sell new plans through the exchange. And so really and truly, as the headline came across everybody's screens over the summer, there is no immediate impact to our customers. All of our customer policies are going to be good and in place through the end of the year. And all this means is as we get closer to the open enrollment period for 2017, as we approach that November 1st date, it's really important that if you have Healthy CT coverage through Access Health Connecticut, that you realize you'll have to choose a new insurance company and a new plan when you come back in to renew that coverage. And so we have established a very clear communications plan for these individuals because they need a very different message. And that message is that they're going to not only need to come back and renew, but they're going to need to select a new carrier. And so making sure that their doctors are in the network of the new carrier they select, and that they can anticipate any other changes they might see. We are going to be communicating with them very specifically. But know that somebody that has a Healthy CT plan right now, they should continue to pay their bill. They should continue to use those services throughout the year. Again, all of it would be covered through the end of this year. So this information gives you the breakdown of our current enrollment by carrier. And so you can see that roughly 11,000 of our members that are currently covered under Healthy CT will need to move to a new carrier. So, go ahead.
So, thanks to Gina. Oh, you did this part too? Okay, so Gina is going to now talk about what it means to be a community partner and how to do that.
So this is our favorite part because this is really where you guys get a sense of who we partner with and how we partner and what we can do to work together to reach the uninsured residents of Connecticut and really talk to those who are insured that need to renew their coverage. So partners share information about our organization throughout Connecticut. We provide materials and resources and speakers where possible to bring our messaging to your audiences. This is a short list of the types of community partners. They don't represent all of them, but to give you a sense, we partner a lot with our community health centers, of course, the Department of Labor, educational institutions, elected officials, healthcare providers, health departments, hospitals, libraries, faith organizations, you name it, our partner network represents it. And it's really important to us to reach across all different avenues to make sure that we can reach the folks of Connecticut. And, you know, making sure that we have strong partnerships in the community is important. So we do have a web page that's completely dedicated to our community partners. We post all of our webinars afterwards on this site, so it's a great resource ongoing. There's also important updates that are posted regularly there, and that URL is learn.accesshealthct.com/community. And so we encourage you to bookmark that site and to visit it often. From there, you can also sign up for our email list so that we can keep in communication with all of the important information that we have. And then coming up, we'd love for you to save the date. We are hosting a community conference on Thursday, October 13th. It's in Cromwell, so it's super local. There's a link here to register. We will be hosting an array of community leaders and influencers in panel discussions around best practices on how to reach the uninsured, taking people through our application process and updating them on changes that have been made to it based on the feedback that we've received over the last couple of months, and really ramping up ahead of open enrollment to make sure that, you know, as we move into open enrollment that we're all really clear about the goals of Access Health Connecticut and how our partners can help us accomplish our mission. As mentioned, we have a ton of materials, and so if you guys all have events happening, if there's meetings, if you interact with our consumers, definitely take a look at the printable materials that we have available on our website. For open enrollment, we will also have materials that we can have available to you for distribution, so certain numbers of printed materials that we can give to you to pass on. And we have them in English and Spanish. We also have certain materials in other languages, certainly upon request. We can get them done for you because we realize those aren't the only 2 languages. So we do have them, I believe, in 15 different languages. But they cover topics around immigration, tax penalty, getting healthcare coverage, special enrollment, financial help, you name it. We've got a material dedicated to it because we realize that healthcare is confusing, even for those who have had it, those who work in it, and so it can be overwhelming to consumers. And so the more materials that we can produce in the languages that they best communicate, the more likely we are to reach these folks. So it's very important to us, and you know, we'll be updating all of our materials for open enrollment and we welcome you to help us in that distribution. We also take our outreach team on events out in the community, and so if there is an event happening in your community where a presentation would make sense from Access Health, or if you think an Access Health table would make sense, definitely contact us. Let us know what events are happening in your community. No event is too small or too big. We've been at them all. So everything from, a health and wellness expo, right on down to a very specific organization hosting a conversation for their community about a topic related to healthcare. So, we really want to hear from you because we realize that you all know your communities, and know that we do have an outreach team that does take part in a number of events throughout the year to reach the residents of Connecticut. So we do want you all to become community partners. This is the information to reach our outreach team directly. along with our social handles. We encourage all of you to follow Access Health CT across the board on social media. We are very active, and we do post often using those hashtags. And so it's an easy way to get really updated information on a regular basis by just becoming a friend or a follower and looking for regular updates from our social media team.
And now, thank you, Gina. That was a wonderful presentation. We do have a few questions that have come in. The first one is asking Gina to go over the 76% of individuals coming through Access Health CT do get some sort of financial help. They just wanted to have you go over that a little bit again.
Sure. So it is a pretty straightforward statistic. Most of our customers do receive a piece of financial help. The larger percentage of that percentage, now we're getting into the math, are going to qualify for the simple advanced premium tax credits, which make them eligible for financial help to pay their monthly premium. And so those are tax credits given. And so when a consumer is on our application, they would see the reduced cost that they would pay on a monthly basis. That said, another portion of that 76% do also qualify for the cost sharing reduction, which then would defray the cost of the out-of-pocket expenses. So that is an additional layer of financial help that is available to a subset of that 76% based on their income eligibility.
Okay, our next question is asking, what if someone moves to Connecticut from the Dominican Republic? What is the special enrollment period for that?
So our special enrollment period for anyone who moves to the state of Connecticut is going to be universal. So when you get here and you contact Access Health, you would qualify for a special enrollment period, and you would have 60 days from the date you moved here to come on to Access Health Connecticut and to select a plan and enroll in coverage. So that 60-day special enrollment window is the same for all qualifying life events that would make you eligible for that special enrollment.
And would that be a similar thing if the consumer changes jobs and is no longer getting insurance through their job?
That would be. So that 60-day window does apply. As I mentioned, Access Health Connecticut is an alternative to COBRA coverage. And so while employers may offer COBRA coverage for those individuals to stay covered, we do encourage everyone to come to Access Health and look at their options, because we might offer an affordable option for you and your family.
Okay, if as one of the community partners, I'm helping somebody find out how to get help enrolling, should I tell them which plan to choose if I know their situation?
So we advise against recommending a plan based on a health situation or any situation. We do rely on our licensed and certified brokers to help individuals choose that plan. So if you get to that point in a conversation with somebody where they're starting to give you a lot of information about their health, and you're not really sure which plan really might make the most sense for them, we do encourage you to involve a broker in that conversation. Brokers are the only folks that can truly recommend a plan based on someone's specific situation.
Okay, a couple more questions. I think the CACs want to know, when will CAC training start?
Well, we love that. We are excited. We think there are a lot of updates that we've made in our system that will help the certified application counselors in their application process with our consumers. And we do anticipate that training to begin on or before October 1st. And so you will be receiving a communication from our training team very shortly on that certification process or recertification for folks that would be returning from last year.
Okay, another question. Do you know where the enrollment locations will be this year, the enrollment centers, and when will they open?
Sure. Our enrollment centers are going to continue to be in New Britain, at 200 Main Street. Got to get back into the game here. And then also down in New Haven at 55 Church Street. And so those are our 2 enrollment centers. But again, we do anticipate having a network of certified application counselors throughout the state. And you can, always visit that Get Help tab. If you're not close to one of those in-person locations, you can type in your zip code. You can find help closest to you. And we do expect them to open in the week leading up to open enrollment, which begins on Thursday, November 1st. Oh, excuse me. November 1st is a Tuesday, so they will officially open on Tuesday, November 1st.
All right, I just want to make one last call for any further questions that people may have. And seeing none, we just wanted to thank you so much for joining us. Oh, we do have one more question. Okay. You're asked to explain again what the special enrollment period is. For someone that comes from the Dominican Republic, I think we went over that, but maybe just one more time very quickly.
Sure. So if you move here from out of state, whether it's from the Dominican or from somewhere else, you would contact Access Health Connecticut, and it would open a 60-day window of time for which you can come through the exchange and enroll. So moving to the state does qualify you, if you don't have coverage, to enroll. And again, it's going to be that 60-day window of time that you'll have to look at your plans through Access Health Connecticut and select the one that makes the most sense for you.
All right. Thank you so much. Now, I would like to encourage everyone to just click on the link to the survey that is in the chat box. Very quickly, it'll only take a minute to fill out. We really, really welcome your feedback on how we're doing on this webinar and welcome suggestions for other topics that you might want to hear about. And thank you once again, and we really, really appreciate your attendance.